Hi, this is Rachel from CGT Aesthetics. Today we are with Sarah, our esthetician, and we are going to be talking about the IPL laser. Sarah, can you start off by telling us what is the IPL laser?
Yeah, so IPL stands for Intense Pulse Light. This laser is really good for anybody who has sunspots, dark spots, any vessels, veins, and rosacea.
Okay, great. And who's a candidate for the IPL laser?
Yeah, anybody who has a lighter Fitzpatrick, so any lighter complexion, so Fitzpatrick's 1 through 3. Typically this isn't good for anybody who has a darker skin tone or anyone who has melasma.
Okay, yeah, because this laser unfortunately could make melasma worse and doesn't work well for people who have a darker complexion because the laser targets pigment in the skin. So we do have other options with our office that are good for melasma and also good for darker complected individuals. Can you tell somebody who's booked an IPL laser what to expect on the day of their treatment?
Yeah, typically what you'll expect is it feels a little bit like a rubber band snap. It's not the most painful and you don't need numbing for this treatment. Typically the feeling is anywhere from like a 2 to a 3. Some areas can be a little bit more sensitive than others. And then any dark spots can start to coffee ground off after treatment. And then any redness and like any vessels can sometimes disappear completely or get a little bit more red in pigment.
Okay. And would you say it takes typically about 15-20 minutes for a treatment? Okay.
Yeah, typically, especially since there's no numbing, it's a faster treatment.
Right. And usually we go over the entire face one time, and then any specific concerns that a patient has, we go over those a second time to target them.
Yes.
All right. And you mentioned a little bit the aftercare, so they can expect their dark spots to get a little bit darker because that pigment is coming to the surface of the skin. Then it'll coffee ground and flake off. How should patients treat their skin after they've had the treatment?
Yeah, so after treatment, you just want to make sure that you're not using any retinols, no tretinoins, no scrubs. Especially if it's starting to coffee ground off, you don't want to exfoliate it off. You want it to come off naturally. And then just making sure you're staying out of the sun. You don't want to be sunburnt or going out and tanning it all after treatment, and just making sure you're just keeping your skin hydrated and keeping to a simple skincare routine.
Yes, and for the pickers out there, we recommend no picking at it because you don't want to create any sort of injury on top of it, which can cause scarring. If someone schedules a IPL laser, is there anything they should do ahead of time?
Yes, ahead of time, you want to make sure that you haven't been in the sun for 4 weeks pre-treatment. And then if you are prone to cold sores, just letting a provider know, and we can get you on some medicine pre-treatment to help with that.
Mm-hmm. And then also stopping any retinols approximately a week ahead of time. Is that correct?
Approximately a week.
Yeah. Is there a best time of year for us to do IPL lasers?
Yeah, IPL is really good to do in like winter and fall time. You do not want to do it in the summertime because you don't want to have that sun. So no sun, you can't be tan, you can't be sunburnt. So fall and winter time is like the best time to do it. That way you're out of the sun.
Yeah, we want to avoid the sun exposure. And typically people will come in after summer because some of those sunspots have come back out again. So people will come for retreatment. Speaking of retreatment, can you tell us about how many sessions people typically need of the IPL?
Yeah, so typically it's about 3 sessions. If it's anything for pigmentation, it's typically 4 weeks apart. Sometimes vessels will book them about 2 weeks apart. And then after that, it would be that maintenance treatments about once a year.
Okay. Yeah. And like Sarah was mentioning, we do have a rosacea treatment with our IPL laser, and that is done once every 2 weeks as opposed to once every 4 weeks. Rosacea is a chronic medical condition that has to do with the vessels in the face. So we typically need to treat it a little bit more aggressively than we do sunspots. We also usually recommend for rosacea patients that they get on a prescription grade skin cream as well to help with that because it is a chronic condition.
Perfect.
Yes, thank you.
Awesome. Thank you.